Welcome, gyno-curious listeners. This is Amy and Allison on Vulva Views. We want to welcome Zara Altbach to the show today. Welcome, Zara.
Thank you. Thank you so much for having me. This is exciting.
We're so
happy to have
pleased.
you.
We asked Zara to join us today because we want to talk about her experience with endometriosis, but also to chat about living with chronic disease and how that might affect one's day-to-day as a mom, as a worker. Zara, when she's not here in the radio station, is an online executive who has built a career in the ad tech space. She's worked for such companies as Google and Yahoo and is currently running business development at a data startup. So after 20 years of living in the city, like so many of us,
Yes,
she
not
now
unique.
she now resides
She followed
in upstate
everybody
New
else
York.
up.
Yeah. And she has a husband and twin daughters.
Thank you so much. I do. I have my twin that are girls. They're about to be 10 years old.
Oh,
they are
double
fraternal. And they are as different as they can be, but so similar and just such these little
Adorable,
love
too.
bugs. Yeah.
Adorable girls.
They are great, fearless and sassy.
Indeed, which they need in this world.
Yes.
I just want to say I like the way you said Yahoo, by the way, before we move forward, because I say Yahoo, and you were like, Yahoo. And I was like, oh, I'm going to start saying it that way.
Do you know when I got the offer letter from Yahoo, they actually sent a letter in the mail, and when you open it up, it went, Yahoo! I am not I kid you not. I opened it up like 10,000 times.
That's
it's like, can you see?
fantastic. That's fantastic. It's all about the voice and the way it's
Exactly.
delivered, and that's why we love podcasting.
Yes.
At least Allison and I do. Yeah. So tell us, how has it been, the transition? When did you move up to upstate?
So we did the weekend home thing. So when my kids were born, we were in a small apartment in West Chelsea.
Mhm.
And so I had come up here for the weekend. Some friends had been up here, fell in love with the area, found a house, snapped it up. This was in 2015, I think, somewhere around there. And then we'd just been doing the weekend thing. And then come March 2020, picked up that last bit of clothing from the city, moved here, and just never went back. So yeah, we're here. We love it. I never lived in the country. I grew up in always cities. So this has been a little bit of an adjustment, but a really fun and welcoming one. So
Oh,
love
that's
it.
nice. I
Yeah.
went into full-on culture shock when I moved up here. I'm glad you had that experience.
Yeah, it just helped Ari being up here and just,
Right.
and when you have young kids too, to go out, to see the difference of them, to be able to go outside, to have a yard, to be able to get dirty instead of being locked into a small apartment. So I think that's really what made it so special
Mm-hmm.
and idealistic.
Mm-hmm. Oh,
Yeah.
indeed.
Yeah. It's our priorities shift when we become parents.
Especially older parents.
Yeah,
Like
yeah.
I had my kids when I was 42. So at that being, I felt like I lived my life fully. And then now I could give up certain things for them.
I personally think Zara looks younger than me. Just want to throw it
I
out
was-
there.
I was just gonna
for those
say,
of you listening who are trying to imagine her. She has this beautiful
Oh,
face that
thank
is so
you.
youthful
Oh,
and
stop.
no,
No.
really,
I'm
Mindset.
52, so I'll be 53 in May.
which is still young.
Yeah. I'm 62.
You look fabulous.
So
I would have.
we are all just
Everyone's
living
wonderful.
fully.
It's the country air.
There you
Amen.
go. Exactly. One of the reasons we ask that you sit with us today and talk to
Mhm.
us is that you've had an experience with endometriosis that is unusual,
Mhm.
even though endometriosis is not terribly unusual. Up to 11% of all U.S. women have the diagnosis of endometriosis. And just to remind people what endometriosis is, it's a disease in which tissue similar to the lining of the uterus, which is called the endometrium, grows outside of the uterus. It goes outside, and it can go to the pelvis, and it can go to other parts of the body. And it can be quite a challenge for women who have this diagnosis. I wanted us to talk about endometriosis in particular, but also for us three to reflect on life as a woman with a chronic disease that we have either learned how to live with or cured or healed, and the psychology of it and the medical aspects of it, wherever this discussion takes us. Yeah.
That's
So
great.
can you tell us kind of the storyline?
Yeah. So okay, where to start? So I had endometriosis on steroids. Let's just put it that way. So I'm going to take a step backwards and say that this is something that I had heard of. I think every woman say, oh yeah, I know what endometriosis is, but I don't think anybody could fully tell you what it is.
Mhm.
And I think it's something that, yes, 11% of women have been diagnosed with it.
Right.
But I don't know how many women actually have it because it's an invasive surgery. And so I will jump
Or
in.
women who have it, who clearly have it just based on history, but who never tell their doctors about it or don't go to their doctors about it. Something like
Right.
that.
They just don't know the symptoms to look for.
Yeah.
And I'll jump into what my story is, but I always knew I was going to have, so I had never gotten pregnant. I always had really bad periods and and then when my husband and I finally got married and we were trying to have kids, we jumped right into IVF. So point being is that I always knew that there was something wrong, but never anybody pointed out to me, oh, have you thought about endometriosis? So let's just leave it at that. And so where my story begins, and I'm going to start from the beginning before telling you what exactly it is that I had, is just one normal day. I'm sitting on the couch with my husband, and this is probably, the kids are about a year and 2-3 months. I can't remember at this point. I'm literally just sitting there, not even moving. And then all of a sudden I feel my chest on the right side just do this little like twitchy thing. And I was like, that's really weird. And it was significant enough for me to notice it, but it didn't hurt. And so it was a pause. I'm like, that is just really strange. Maybe I'm starting to get a cold or the flu. I have no idea. So I didn't think anything of it. A couple days later, I started to have some pain on the left side. And so I'm like, okay, I should go to the doctor and see what's going on with me. He listened with everything, the normal stuff, and he said that he thinks that I had bronchitis. And so he gave me an inhaler. So I went home, started to take the inhaler, cut to about a week later. I couldn't walk. It was so hard for me to take a breath. And I couldn't, it was a pain to even take a step. And so at this point, I'm like, I need to get an x-ray. So I went to my doctor and I said, please just let me get an x-ray. I don't know what's going on with me. And so he's okay. He gave me the script. I went and got an x-ray. This is in the city. And then I was working for Google at the time. And so I went back to the office. And then he called me a couple hours later and he said, where are you? And I'm like, I'm in the office. He said, you need to go to the ER right now. You have a fully collapsed right lung and you need to get that taken care of.
Oh my gosh.
Whoa.
And that is the last thing I had thought was going to be the case. I didn't even know what that was, what that meant. And so I went home, got my stuff together, and Andreas, my husband, we took me to the nearest hospital. And so when I was there, everyone's, oh, you're tall and thin. You probably have a spontaneous pneumothorax. Like that could happen every now and then.
And that's a collapsed lung.
That's a collapsed lung, correct. And so I'm like, okay, I guess so, fine, whatever. And then we decided at that point that I wasn't going to have, that we would have it resolve itself because I didn't want to have where they'd stick this tube into your chest and they let the air out to have all of the air come out so that your lung can re-inflate itself. So cut to, I let that happen. My lung resolved and I was feeling better.
How long did that take?
Actually, no, it didn't resolve. Yeah, it took a couple of weeks. And actually, and I'm going to apologize to the audience. This happened to me about several years ago, so I might have to put my thinking hat back on. But it didn't resolve itself completely. I did have to go and see another doctor. And then that's where they decided they did do the inflation. So they did I went to another hospital where I felt more comfortable with the doctors at the point. Because the first hospital, it was interns, and I could see the excitement on their face because they'd never done it before. And I looked at my husband. I'm like, I can't do this with people that's never done this before.
Was this in July by chance?
I can't remember. No, but it was like they just got out of school, and I could see them.
That's right.
Like
we get to put a hole in somebody.
You know, there's this saying, like, you never go to a hospital in July because that's when
Really?
all the
I
new
have heard that.
interns
That's when they all get hired.
I didn't know.
Yeah.
So I went to the hospital. I went to see where a family doctor told me to go. We went to the ER, this and that. And so then they did. They put the thing through my chest and then they let the air out and then it resolved itself. So I apologize. That's what happened for that point. And so then that was all good and dandy for about a year. And then I was feeling great. And I'm like, okay, never even thought about it because I think, this is fine, all good. Same thing happened. I'm working. All of a sudden I feel that similar shift just take place. And so by this point, I knew the drill. And so I walked over to an urgent care. I had them do an x-ray. They confirmed it for me. And then I went, got my stuff.
Again, a pneumothorax.
A pneumothorax, correct. I got my stuff and then we went back to the ER. And then I saw a thoracic surgeon at that point. And then that's when they decided to do the surgery. And so the surgery is that they scrape the wall of the lung wall. And then they literally reattach the lung like by stapling it.
Oh my
So
word.
it's a barbaric and horrific surgery. I'm not going to lie. It was really painful and it was horrifying. And so at that point, I'm like, okay, we did this. I'm good. The doctor said I'm good. We should be good to go.
Because at this point, they're just thinking you're having spontaneous,
Correct.
can't explain it, but just some
Correct.
weird star and moon positioning,
Correct.
and you're having these
They took care of
pneumothorax.
this part.
That's right. So the
Yep.
idea, just to explain it to the audience, what Zara is describing is, so a pneumothorax is when air gets outside of the lung and compresses it. And that's not normal. And so the surgery that she's describing is the concept of, we'll just pin it up, we'll hold it up so that it can't collapse again. So the air won't go out and push it down. So yeah.
And just for the severity, I think this is important to note too. People get pneumothoraxes as well from like car accidents or very severe types of punctures that you hurt the chest. And so that's how much of an impact it takes to cause one of these to happen.
Right.
really bad infections can sometimes do it as well. And there are what we call idiosyncratic. This is where somebody has an event like a pneumothorax and we scratch our head and we're like, I don't know what this is. I don't know why this is. We can't explain it.
Yeah.
Yeah.
I also just want to take a second to add that you did an intro about being a mother, but this is all going on and started around the time
My babies.
that you had 1-year-olds at most, twin girls that you had just gone through. I don't know, you didn't share how many rounds of IVF if it were successful, but that in itself is a tremendously stressful
Thank you.
experience.
Yeah.
And then what about delivery,
And
Allison?
then, but to go right into, you have your children, and then there's this joy, and then all of a sudden you're going back into the ER for multiple. That is huge, and you have a full-time job. Well,
Thank you for recognizing that. The IVF thing, I was going to kind of weave into the whole thing because I think it's an integral part as I get to the punchline, if you will. But so after this point, when I had the first collapse, I should say, I had the first collapse when they did the thing, they stapled me up, they said I'm good to go. It happened again, out of the blue. I'm just sitting there, and then it just happened. I couldn't believe
How
it.
much
And
later?
this point, this is about a year later.
Wow.
And so at this point, I'm actually upstate in the house, and it's on the weekend, and I had been in a bit of pain, but I knew I had a small little pneumothorax, but it could have resolved itself. But then it fully happened again, and I couldn't breathe. I had gotten myself one of those oxygen meters because I was so nervous. I was doing that all the time. And I also should say, I was constantly going. This is one of the things that's important. I was constantly going back to my surgeon, my thoracic surgeon, saying, I don't feel right. I am feeling like it's happening to me more, and I can't explain it, but I don't feel right. And he kept on saying, no, it's okay. You're that whole, I felt stupid every time I wanted to come in. I felt like I was bothering the doctors. I was like so apologetic. It's me again. Here I am. I'm sorry.
the problem. It's me.
But I just don't feel right. And then I should say that when all of these visits that I was sitting there with him, I was like, okay, so can I just go through some stuff with you to find out if we can find something that's just off with my body? So I'm 43. Am I perimenopausal? Could it be hormonal? Like, here are the changes. I did IVF. Here are the changes that's happening to my body. Could that have something to do with it? And there's something called catamenial pneumothorax, but it's very rare. And it's only something that happens to such a small percentage of women. And I'm like, what does that mean? He's like, do you have endometriosis? And I'm like, I don't know. I've never checked, but I've had bad periods and stuff, but I don't know if I do. He's like, it happens with women that have endometriosis, and it's always usually on the right side. I'm like, this is on my right side.
Right.
This might be something that I want to explore more because this seems to me like it might hit the mark on that. And so I went home and I remember Googling catamenial pneumothorax. Nothing came up. It was like something where it was just maybe 3 papers from an obscure hospital or something, or gynecologist association had done it. And I felt like, what is this? Like, why can't I find anything on it?
Let me just interject. Catamenial means menstrual, during the menstrual cycle.
Yeah. And so he also said that this could happen during your period or when you're ovulating. And so I started because I kept a log, and I started to backtrack. And I'm like, the last time I felt this way, I was ovulating. And I had my period. So there is a correlation here.
Wow.
And maybe this is something that I do have. And so if I do have this, what can I do? So I made an appointment with him. This is, again, before that third. So not to confuse anyone, because I apologize. I'm rambling around, but this is before the third collapse. I went and I made an appointment with him again to talk about it. If it is catamenial thorax, what are my options? And so we talked about the birth control, that there's other pills, and there's some pills in general that could stop your menstruating and all of this. And I'm like, okay, so these are some things that I can think about, and these are things I need to study for myself. So as I was going through this process and thinking about it, and I have to say, my mom was a very instrumental part of this too. So she was my person to bounce things off of. And we were going to, I was at Northwell, and she looked and tried to find a doctor that was in the world of endometriosis. And she found Dr. Tamir Sechkin that was there, who's a very famous, renowned surgeon within the space. And so we knew that he was associated with Northwell. So cut to, now I'm back upstate. I haven't been able to breathe. I'm like, oh my effing God. It happened to me again.
Oh my God.
I called the surgeon. Are you sure? I'm like, I'm pretty sure. My oxygen's at 92 and I can't go on my side, and it's hard for me to breathe.
I have to cut you off there. When you describe going to the thoracic surgeon, and
he's a lovely man.
Oh, I'm sure.
Yeah.
I'm sure. But when he poo-pooed you at first, no one out there listening to us knows how Alice and I looked at each other and rolled our eyes. It's like this storyline, Allison, we hear so often.
And I wanted to say, so thank you for just jumping in. In my head, I was thinking, once again, leave it to the woman's intuition and instinct to go off and be the one who does the exploration of the possible diagnosis and to bring it back to the doctor. And again, you poo-poo, I don't want to poo-poo the male doctor, but men don't know women's bodies as well as women know their bodies, even if they've studied them clinically.
And Zara saying, I know something's
wrong.
I must, as a clinician, I can't tell you how rarely is it that a woman says to me, I feel like something's wrong, and they're not right. So that's a lot of double negatives. Like, women know their bodies.
100%. And these doctors stay in their lane. Because they don't look outside the box, mostly because most people fit in the box.
That's right.
I happen to be outside of that box, and I happen to be the one that just the rare version of what he was talking about.
Right.
And so for him to think about that, I had to joggle his mind to get to that conclusion. Oh, maybe it is that. And so to be your advocate is what you guys were saying.
Essential.
Yeah.
Yeah. And we've said that before, but I'll say it again.
Yeah.
Do not be afraid to stand up for yourself, even if you're in the room with someone who is claiming to be the expert, because actually in that moment, you are the only expert of your own body and your own mind. So do not be afraid to push back if you have to. Because I've worked with women with PTSD who have dealt with situations like this, and the one repetitive variable that I hear that they regret is that they did not say something.
Yeah.
Because they knew they were correct and they knew the doctor wasn't really catching on at the time, but they were intimidated by the degree, the diploma, the history, the knowledge.
And the demeanor. If a doctor looks at you
for sure,
and rolls his eyes, mine didn't do that, thankfully, but that kind of, okay,
yes,
look. There were some of the nurses, when I was in there, I felt that kind of, oh, you little sweetheart.
Right.
You're okay.
Oh, you're going to be fine.
You're fine. Do you need some medicine for your anxiety?
You must be depressed. Oh, yeah. I know that. It's and I hear that all the time, and that's how we get treated. Yeah. Oh, she must have postpartum.
Yeah.
Or she must be really stressed about being a mom. I'm like, fuck you.
Yeah.
This is not what's happening. Listen to us.
Again, there's such a stigma to hormones and postpartum, all the things that happen to us women. There's just so much fear of talking about it. And just to be an advocate for my peers, it is true that this catamenial endometriosis is extremely rare.
Mm-hmm.
And so it's not the first. You're going to tell us more about that in a second. In our mind, in my professional experience over 35 years, I've seen it twice.
Mm-hmm.
And I've seen tons of endometriosis. So it is not the first thing that comes to my mind. However, it certainly should be for any thoracic surgeon or, quite frankly, any gynecologist who has a woman come in and say, I'm having spontaneous pneumothorax. It's a trigger. It should be a trigger. And certainly
100%.
It should be, the incentive should be, I got to figure this out.
Yeah.
I have got to understand why this is happening to someone.
It should at least be an option explored.
Indeed.
Yes.
Indeed.
And when I finally went back to the ER then for my third and collapse after having it stapled, which it blew my thoracic surgeon, like his mind was blown, honestly. I saw his face.
Every time you say stapled, I'm like grabbing my chest.
Yeah, you know what? I have no lubricant, if you will, in my chest anymore. So every time I cough, it's like raw.
Oh
right
my
here.
gosh.
And the nerve, it's barbaric. So cut to, he wanted to put talcum powder. Like the thing that we also talked about too was if you put talcum powder down, it burns the skin. So it actually makes it adhere more. And my mom was like, absolutely not. She said, you are going to go find Tamir Sechkin right now. And you're going to go see if he can come in while you're working on her, you're already opening her up for her to
see if
fix the lung, see if she has endometriosis.
Right on, Mom.
Go, Mommy.
Yep. Yeah.
Yep. And he's okay. So he went and he found Dr. Sechkin, and we badgered Dr. Sechkin. And to his credit, I'll never forget, I'm in the hospital room and he comes in, he's, who are you? Are you a doctor? I said, no, but I need you. Please, I need you. I beg you right now. I think I have endometriosis. I think I have catamenial pneumothorax. Can you please work with my doctor to see Dr. Byron to see if I do in fact have it? He's extremely busy.
Mm-hmm.
He made the time for me. He carved his schedule, and he and my thoracic surgeon were able to go in together, and he confirmed that I did have endometriosis, and it was going through my diaphragm.
Oh my gosh.
And up through into my lungs. And that was causing, so think about it, guys. Think about this. Think about the female body, that when you have a period or ovulation, the strength of your internal body that can suck down
and collapse your
lung.
Holy
Not
moly.
even when it's been surgically adhered. So it's incredibly, just mind-blowing of what a woman's body can go through.
Why
first
you don't mess
and
with women.
foremost. Right. That's insane.
That's insane.
It's
and also
insane.
to think about, essentially, it's the endo is powerful enough to pierce through the diaphragm and the other layers of tissue without you knowing before it
Did you know it can go to your eye? It can go to your anus.
Yes.
It can go to it can go anywhere and
I
everywhere.
have indirectly worked with this surgeon because I was the therapist for one of his patients, and she had one around her anus to the point where she couldn't even go to the bathroom anymore. They had to put a bag on her, and then he performed 2 surgeries so she could again have a successful digestive system.
Yeah.
So this man is a magician. He's a miracle worker.
So Dr. Sechkin, he was amazing. So as I said, he came in, he couldn't exercise all of the endometriosis this first time, but he was able to confirm that I did indeed was a pretty good candidate. I had a lot growing. And so here's where I get really irritated. So to cut to what you were talking about with IVF, I knew I couldn't get pregnant. And so I had gone and worked with some IVF specialists, my gynecologist. I even had some DNCs because I had some issues. Can you see if you have endometriosis if you have a DNC? Is that even possible to see?
No, because it's going, endometriosis is when the lining of the uterus goes out in the unusual direction, not down, i.e. a menstrual cycle, but goes out, and we think it's through the tubes. We actually don't know how endometriosis, why it happens. There's something called retrograde menstruation, the idea that the menstrual cycle doesn't just go down through the vagina and out, that it goes actually through the tubes, and then that blood and that tissue gets deposited in the pelvis or elsewhere. But that's only a theory.
That's only right, because there's not still a lot of unknowns.
That's right.
But why don't they? Obviously, I know the reasons, because it's money generation. But if you're going through IVF, one of the first things that should be checked is if you have endometriosis, because if you do, you remove it, and then you can
might
have
get
a
pregnant.
baby, maybe, instead of pumping up. So here I had endometriosis. I'm pumping myself up 3 years of hormones. I was trying to go have a baby for 3 years, which my babies are miracle babies. They actually shouldn't be here, quite frankly, after all this. But I was exasperating everything without knowing it and without understanding what I was doing to my body by feeding the endometriosis, pretty much, with all of the hormones that I had been taking. And thankfully, I was able to have the kids, and I carried them to term. But given that, I truly believe that if somebody would have said to me, can we try and have this be as one of the efforts to see before we put you on all of this, if we could solve this, I would have said absolutely. And perhaps that could have
Did they do any
alleviated.
testing to evaluate the patency of your tubes, a hysterosalpingogram or
what?
chromotubation? These are
remember.
different techniques
Do you think when I was going through IVF?
prior to IVF. So the idea is that
I don't
a
remember.
lot of women who have endometriosis will have scarring in the pelvis. And that scarring often involves the fallopian tubes. And remember out there, the fallopian tubes is the conduit. The egg gets deposited out of the ovary, goes through the fallopian tube. If it meets a sperm, it makes a fetus, and then it implants in the lining of the uterus. With endometriosis, what can happen is that tube gets blocked. And so we have ways of looking at whether the tube is open, or what we say patent, or whether it's blocked. And if it's blocked, we have to say, that's probably endometriosis, particularly in a woman who says, I've had miserable periods, symptoms very much consistent with the clinical history of endometriosis.
I don't think I had that done to me.
Yeah.
So, Amy, would you suggest that when people are going in for IVF that they request that?
Yeah.
Well, there's a series of steps that most reproductive endocrinologists will do when they're evaluating a woman for fertility. Now, for some, I guess I'm going to say, I think some clinicians may jump to IVF based on a woman's age, and they make certain assumptions just based on age. But the testing that I'm talking about, though it's not pleasant, it's not terribly invasive. And it's very helpful to know if the tubes are blocked.
I think I had some testing. I know I had some testing done, but what came back to this is before the IVF is that I had precancerous cells. And so I was given some pills to take to kill.
Jeez, why not? Throw a little more in there.
But nobody, I'm trying to think, if I did have that done, he would have seen it, and he didn't. So I don't know.
Yeah, I'm afraid I'm not sure what that storyline is talking about.
Yeah, that's a whole other episode.
Yeah, I'm trying to think. The only thing that they might have done in an attempt to evaluate your fertility was a pap smear, which is a screening test for cervical cancer where there can be pre-malignant cells, or an endometrial biopsy where they're looking at the lining of the uterus. But that's an old-fashioned intervention. We don't do that a whole lot anymore, so I don't know.
But I think to Allison's point, I think any woman that's having, first and foremost, if you're trying to conceive and you can't, then talk to your doctor and request
before jumping into all of that.
Absolutely.
Back to the advocating. And you gave a beautiful example. You and your mother spoke to a world-renowned surgeon who had no time and said, please get in here. And he did. And that's so you speak up for yourself. These things can shift and change.
Yeah. Listen, the good news of all of this, which I actually makes me feel very proud, is that I was able to get two doctors together that never worked together.
Wow.
And now they do, and they did. And they had other cases, and they knew what to look for. And they actually made it a standardized practice at Northwell to have these two teams work together. So that was something that I at least feel was something worthwhile for all of this. And it takes time. And as we all know, the amount... Who's going to put the research and time into catamenial pneumothorax?
And not only because it's so rare, because it's a woman's health issue.
Exactly.
So it just is what it is. We still are not getting the amount of money or attention towards our care.
But do you know how isolating it is? And I think I said this earlier, is when you're trying to Google, and thankfully there was a Facebook group that had started with a few women that had it. That saved my life because I didn't feel like I was just this weirdo freak. There's other women that we had the same symptoms, the same fears. When your arm hurts or your leg hurts or whatever, it's going to be okay. When your chest, I thought I was dying all the time. When your chest and your lungs, and I thought you just don't know. And so anytime I felt discomfort, I constantly had this fear I was going to die. And to your point about my kids, I felt like I lost a good year and a half of their life because I was so preoccupied with what was going on that I couldn't focus, and it was just all a blur. And so when I finally, Dr. Sechkin, he confirmed that I had it. They reattached the lung again. They didn't do the talcum powder, thank God. They just reattached it. And then the next step was to have a hysterectomy, which Dr. Sechkin did. So he then removed the rest of the endometriosis, and I had a full hysterectomy. So I just have my cervix. And from that day on, and that was in 2018, I have not had any collapses that I know of.
So let's just clarify for the audience.
Yes.
When you mean a full hysterectomy, did they remove your ovaries?
Yes.
Just to help people understand why that is true. And how old were you?
2018. I think 45, 46.
40. Yeah.
Yeah.
So this is a big surgery. And what Zara is talking about is the removal of the uterus, not the cervix, which is the lower part of the uterus, and the ovaries and fallopian tubes. And the reason for it is, one, the doctor wanted to get rid of the source of the endometrium. That's the lining of the uterus. You can't get rid of endometrium without getting rid of the uterus. A DNC, an ablation technique, these don't do it. And then they went on to remove the ovaries because the ovaries are the hormonal source for enriching or feeding endometrium. So if a woman has endometrium in her lungs or in her pelvis or in her diaphragm or in her colon, every time you get a surge of estrogen, that endometrium acts up. It prepares itself almost for a period. So imagine having a period in your lungs or having a period on your colon. It's
cramping and
terrible. Yeah. Allison's pointing out people get terrible cramps with their periods. They often have infertility. They can have defecatory problems. They can have bladder issues. It can really affect the whole body and system. So again, the surgeon decided to say, you know what, instead of approaching this medicinally, probably because of your age.
Well, I was lucky. I had my kids.
Had your kids.
I don't know. I had met women that were in their 20s that went through this, and that's a whole nother, it's not an easy decision to make then. I was very lucky where I was in my stage of life, that it was a no-brainer.
Right.
I have a question related to your children, because you were just saying a moment ago that you felt like you lost some time with them and that you were so distracted by this. But I imagine now that you have 2 daughters, and we know that these things can be hereditary, that you must already be thinking that when they approach the years of puberty and get their periods, that you are going to be on top of this.
I will see what their periods are like. I will make sure. Yes, 100%. Yes.
And as your mother advocated for you, just knowing you for the brief time I've known you, I would call you an advocate.
Thank you. No, you have to, right? And I think just watching the signs. And I think that the first one is, are their periods super painful? But that's I don't know. There's so many different ways to look about it. But should every woman have an invasive look in there to see? Do you think, Amy, that there's more than 11% of women out there that have endometriosis?
Yes. And the trouble with this disease is that, for example, women who do have diagnostic laparoscopies, where we look inside with a camera into the abdomen and pelvis, you can see a woman with terrible endometriosis, obvious endometriosis, who has no symptoms. You're going there for some other reason.
Right.
Or you can look in and you'd put all the money on the endometriosis, spot and say, it has to be. Everything this woman tells us reminds us of endometriosis, and you don't see a thing. And so you're left scratching your head and wondering, okay, what do I do next? Right now, the current trend is to treat someone with painful periods or painful sex associated with their periods, or symptoms that remind us of endometriosis, is try to use medicines first. Because if we can use medicines to change the communication of the brain to the ovary, and thus the output of estrogen and progesterone that is feeding the endometriosis or causing it to grow, that's the first step. And yes, we do believe that's safer than going right to surgery. However, if somebody is using one of the medicines, and there's a variety of them out there, or can't take the medicines, or have tried or getting too many symptoms, then yes, a laparoscopy is the next step. Because if you see endometriosis, then the treatment of choice is to remove it. And there are several approaches in which that is done, but the best way, typically one, is with an endometriosis specialist.
Yes.
Someone who has seen this over and over again and knows how to remove it fully, or as best as we can.
Because if they don't, then it could just grow back, right? That's why with Dr. Setchkin, he's so world-renowned, is because he's been able to fully get it all out and give you that peace of mind, whereas other doctors may not have. Which, to me, I don't know if it's so. It's fascinating to think if it's so small or whatever it is that they could miss. I don't know.
When I was trained, so what you see when you look in the pelvis are a variety of things. Everything from scarring, so pieces of tissue, bands of tissue between an organ and another organ that you don't otherwise see. So strands of tissue that might be connecting the ovary to the uterus, for example, or to the side wall of the pelvis. You might see what we call brush burns. These are little black spots, as this, pardon me, it's like someone putting a cigarette on tissue, and it leaves this kind of blackish red spot. It's the only way to describe it. Yeah. Sometimes there are these little vesicles. They look like little bubbles. So there's an array of appearances that endometriosis can show. And when I was trained, what you did was you coagulated these spaces. You took what's called a bipolar instrument, which is electricity, essentially heat, and you burned them. And that was a way we thought we were eradicating the disease. And for some people who have very superficial endometriosis, it's just on the very top, a thin coat of icing on a cake. That works. But if you've got icing that's pouring down into the cake, the bulk of the cake, that's deep penetrating endometriosis, and you're not doing a whole lot for that person. So the newer surgery is about getting as deep as you can safely. Remember, there are certain parts of the anatomy you can't dig in deep. If this endometriosis is right over your ureter, the tube between your kidney and your bladder, you don't want to compromise the ureter. So we do what we can based on where it is, what it looks like, etc.
Got it. It's
Yeah.
crazy.
Did you write that
isn't it?
down?
Yeah, I know.
Did anybody hear that?
No, but
that was like a foreign language, but I'll go back and listen again.
But it's so really important for women to know this and to understand it. It really is.
It is.
Yeah.
And it's like you said, if we know the information and we learn from others that are willing to share, and we can go in and say, I want you to check for this, or I want someone to please listen to me and take me seriously.
Yeah. And Allison, I want to go back to this issue of being a mom pretty recently postpartum, and then living with a state of illness. I'll call it a state of illness because at that point they didn't even know what it was.
Right.
And how we can help women out there listening to us cope with that level of stress.
I think it really just goes back to what you just said. Listen. Listen. Sit there, let them be the expert of their own bodies. That's something that I was taught when I was training as well, is you are now an expert, but the real expert is the patient. It's not you. You are speaking from a clinical perspective, and they are the ones that really know what's going on. And so you need to be quiet on occasion and objectively listen versus, like you said, some doctors will roll their eyes and get irritated.
Validate. You want to be validated.
You want to be
Good
heard.
word.
You want to
Good
be
word.
heard, and you want to be validated.
Yeah.
And even if in your mind what you learned is not computing, that doesn't mean that it isn't possible. So I think just listen.
And time. It took me years to believe that this wasn't going to happen again. And I still went to many urgent cares, like, and I had so many x-rays that, like, I think they knew me by name. Some of the places, like, oh, there she is. Come on in, Zara. But I had to do it for my own peace of mind.
Absolutely.
And I didn't care about the radiation. I'm like, I can't rest until I know I am okay. And so I think it's just not letting people try to dictate what you can and can't do.
Right. And tell you that they know better than you when you're having the experience. That's what I think.
Yeah. And any of you out there, I think all of us have experienced that feeling of shortness of breath or unable to breathe if we have a really bad cold. And it's, my nose is all clogged up and I have to breathe through my mouth, but I'm feeling anxious. That is an incredibly scary feeling. And you're describing trauma. You're describing an experience where there's enough muscle memory, mind memory, emotional memory, breath and memory around 3 events where you were unable to breathe. And I get it. I totally get it. And I'm so glad you were able to say, maybe it's nothing, but I am going to check it out. Maybe I just have to be consoled in knowing that this isn't what I've had in the past.
I can't imagine the alternative had this not been, like, fully.
Yeah.
I honestly can't imagine the alternative. And I also very lucky to have lived in New York City at the time. Again, going back to that Facebook group that had women all over the world, and a lot of African-American women. This hits the African-American community quite heavily too.
Right.
And they're in middle America. They don't have the access to doctors like I did. And that for me was something I'm super thankful and I acknowledge. But to hear their stories and to be able to have a community where these women could at least go. And I encourage, again, listeners that need to see, you have to have a community. You can't do this alone. You need to, wherever it is. I thankfully was able to find something on Facebook. Wherever you could find somebody that is going through something similar, it just makes you feel so much better. And so with that said, I wanted to do as much awareness as I could about catamenial pneumothorax. And that was something that I decided, and this is, if I had it, like, how can I get this out to the world? It may be rare, but I don't care. People need to know about it. And the Lisa Sanders, the diagnosis in the New York Times. So I emailed her. I'm like, listen, I have Catamenial pneumothorax. Would this be of interest? She literally called me within 2 minutes. She said, yes, I've been looking for this.
I bet. Wow.
And so she did she did a segment on me. And to the point where
that was you.
That was
I
me.
remember that piece.
Yeah, that was me.
That is so funny. That's
me.
great.
Yeah.
That's great.
So point being that women would email her and she would send them to me. And she'd be like, you can email them back. You can do what you want. So I corresponded with a few of these women. There's one that lived in New York. And this is the craziest story. So we're like, let's meet for coffee. I'm on the West Side. I'm on the West Side. I'm in Chelsea.
Get out of here.
I'm on 23rd and 9th. I'm on 23rd and 9th.
Oh my
You're
gosh.
kidding.
Guys,
not the same building.
Same building.
You're
same
kidding me.
Floor. Same building. Same floor.
You just got the chills.
Are you serious?
No. 100. I had seen her in passing. We never spoke. All of a sudden, we looked at each other. We're like, oh, and we hugged. She was a German woman there. She lived on the other side of my floor, had the exact same experience, had the whole thing that I had, and it was similar timing. She didn't have children, but everything else was the same. And so to your point, Amy, yes, it's rare. It is. But what are the odds of having two women around the same age that had the exact same thing and the same building, the same floor?
I cannot even get my head wrapped around
this. Me neither.
Right?
I don't know the math there. It's just extraordinary.
It's extraordinary.
It's really extraordinary.
Wait, I have a question, Amy, that Zara mentioned that this is very prominent in women of color, in African American. Do you know the reason behind that? Or no?
No,
that's something I'd like to...
Again, there are theories. And the trouble also is that, as we know, women of color have lack of access and lack of equity in terms of treatment.
Yes.
So these are also women who have storylines of 3, 5, 8, 10 years of being evaluated.
I see.
And no one giving them a diagnosis and no one giving them the time of day, certainly treatment, et cetera. So no, we don't know. There may be some association if someone is carrying extra weight, then we have more endogenous estrogen in our body. And if we have more estrogen in our body or we're getting it through medications, then maybe that's feeding the endometriosis more. I don't know. Yeah.
I'm just fascinated by the entire... I'm literally in my head trying to remember things to share with friends after this conversation. This is what you should go ask to do. Tell them to give you this test.
Can I ask a question that's not related but somewhat is? What is your stance on an elective hysterectomy, that women would be able to have a choice to get a hysterectomy at a certain age? Do you, as a doctor, how would you feel about that?
What an amazing question. And you're right, Allison. She's got it all.
I told you.
She's got it all. Thank you, Zara.
The women that I'm slightly afraid of when I first meet them. And I think, oh, we are going to be friends in no time. Because I'm very drawn to the no bullshit. I know what I want. I know what I like.
Well, there are 4 very powerful women in this room, and I'm including our producer, Jen Hammoud. And I love all of us too. An elective hysterectomy. It is a very important question for someone to ask their doctor if they feel that's what they want. It's often a complex thought process and answer depending upon age, depending upon, is there a disease? Is this for gender affirmation surgery? Is this because I just hate my periods because I hate my periods? Oh no, I don't have pain. I don't have a lot of bleeding. I just hate my periods. There's so many reasons why a woman might ask to have the uterus removed. And so I can only speak for myself as a clinician that what I know about surgery, and this is major surgery, even though we can do hysterectomies through tiny incisions these days, laparoscopically. So the recovery is shorter than when we used to make a big incision. The overall impact on the body is probably less. That the fact is it's still major surgery. You are getting anesthesia, which impacts the body. You are removing an organ that has a function in the body. I often tell women that silly song, the knee bone's connected to the ankle bone, the ankle bones, that we're connected and that the beauty of our physiology and anatomy and capacity is that there's a connectedness. And the reason that Allison and I so dig each other is because we understand the connectedness of the mind and the body and the spirit and the body. And I think all of that comes into play when we have surgery. And I mean any kind of surgery. I don't care if you're taking a little ditzel off a hand. I've seen bad things happen for minor surgeries. In fact, I never call surgeries minor. Even if you will, an insurance company calls like a D&C minor surgery, a hysterectomy, major surgery. I think that, where do you draw the line? My goodness, I think it's all surgery. And I really try to understand what my patient is asking me for. Why is she asking for this? What is it? Is it an emotional component? Is there something going on physically that is just so challenging every month with a menstrual cycle? Is there, again, something about the way they identify with their gender and sexuality that's the problem, et cetera, et cetera? Certainly if there's cancer, what are the options? Is surgery always the answer? No, it's not. So there's all these questions that I ask, and I almost always preface with, this is not going to be a one-visit conversation. We can email, we can talk on a phone. You don't have to come in every time, but I'm not going to give you an answer right now because I need to know you a little better. I need to know why you're asking me and then come to a decision together that feels right. And without being too, I so believe in body autonomy. I so believe in personal autonomy around medical decision making. But asking someone to just do a major surgery on you because maybe it's something you think you want, that's not sufficient on an initial conversation.
Got it.
Yeah.
What a great way of putting it. For me, I guess I can say is because I had it done and it seemed, and I'm not going to minimalize this in any way, but compared to the other stuff, it was a walk in the park. And then I see again, and I'm just putting out, this is nothing that is concrete of evidence. I'm just putting out what I've seen and having gone through what my personal experiences have been. But then I see what other women are going through with perimenopause and years of suffering, which if they would choose on their own accord to have a hysterectomy to maybe alleviate 10 years of something, is that something where do you think the medical profession, because for me, I was in and out in 24 hours and I didn't have any issues. So again, that's my own personal experience. But everything you said is completely 100% valid and I completely agree with you. I just wonder for the women of an age that is tired of going through the perimenopause and just wants to reclaim her life back. Do you ever foresee that being an option?
Great question. I'm not going to lie. There are days where I think of asking you, like, do you think I should get this thing taken out?
I think it's such an important and interesting question because, sorry, I'm going to harp back historically. So I can't help but have a historical lens around gynecology and the way medicine has treated women over time. And I think we've talked about, we used to use the word hysteria to describe women because, and it was all about the uterus.
Yes.
And bear with me, I don't mean to be, how shall I put it, a little paranoid. But I think some of that mentality still exists. So my mission is to make sure that women are advocates for themselves, have full information, that they're not patronized when they're in a doctor's office, and that decision-making is informed. Now, so there was a time where hysterectomies were, every day somebody was having a hysterectomy. They were in my early residency.
Really?
Oh my gosh.
Yikes.
I can't tell you how many hysterectomies I did.
And those were the days where you were in the hospital for like days.
You
right?
had an incision, whether it was from your belly button down to your pubic or from hip to hip.
Yeah.
This was very major surgery. And it was just the treatment of so many problems because we didn't have the medicines.
Right.
We didn't have other lesser surgical interventions. We didn't have IUDs with hormones in it to help with heavy periods, et cetera, et cetera. So it was the treatment that everyone did. And that was, so that even predated laparoscopy. And then finally we knew how to do hysterectomies laparoscopically. And yes, it allows women often to leave within 24 hours from a hospital. 2 weeks of healing, that's not major unable to get out of bed, but just an awareness of their body, and there can be some discomfort, of course, it's still surgery. So then it brings me to today, where people can go onto Google, where they are aware of the perimenopause, where they understand, I don't necessarily need to go through this suffering. There are options out there, and surgical intervention is one that I should consider. And I would just say to you, ask your gynecologist, talk to that person, because maybe, one, you've exhausted all the medical interventions, right? And it's a very reasonable question or inquiry or request. But from a surgeon's point of view, and this is always the hard one because it sounds a little patronizing, and I have to really check in with myself when I say it to people and as I share it with you today. I've been in operating rooms where we thought, oh, this is going to be really simple. This is going to be really straightforward. This is a slim woman, no medical problems. Her anatomy is beautiful. She doesn't have terrible endometriosis, scarring everything. She isn't morbidly obese, where we have to take extra hours sometimes to do the surgery. Where, again, we think it's straightforward and simple. And then something happens. And I've seen major complications. Hours more of surgeries, calling in vascular surgeons, urologists, ICU visits. Now, does that happen often? No, thank goodness it doesn't.
But it does happen.
But it does.
Yeah.
And there's my trauma.
Yeah.
I'm speaking to my trauma as a surgeon, where I've seen stuff happen that was so unexpected, and women were impacted in such major ways for a decision that may have been maybe a little bit based on convenience. So I have a mantra in my practice now.
I get
That's
it.
fair.
Yeah, I have a mantra in my practice now, and it's learned by experience, where if someone asks me to do a surgery sooner than later, this is an elective surgery, sooner than later because they're going on a trip or because their insurance is ending, both of which I fully respect, I never say yes. Because my experience is when I squeeze someone into my schedule to do something because I want to be kind and honoring of the schedule or the insurance, stuff happens.
Yeah.
And it's, it sounds superstitious, and it is superstitious, but I've had enough experiences with it. I just listen to these trends, and I'm not alone. I have colleagues who say the same thing.
That makes sense.
So it's a big picture. That's what I would ask any gynecologist to think about and any patient to think about. And it's hard when you don't have, if you're not a gynecologist and the patient, you don't have both perspectives. And that's why I like to talk about both sides of the speculum in this podcast, because it's an exchange. How, if you came to me with your storyline, I would have not said anything but yes, when can we do it?
Yeah.
You're right. It's so clear.
Yeah.
But it's not usually that clear.
No, everything you said makes sense.
It's a great question. Thank you, Zara.
Yeah.
Such an important question. Yeah. Ah, I just went a little bit on a soapbox there, everyone. I apologize. It's so funny. What this podcast has done has so reminded me of issues that I feel so strongly about that I don't realize I feel so strongly about until someone asks me the question, and particularly when we're in the room together, Allison, I reflect on it in this full way, and it's terrific. But again, I feel a little bit like I just went out there on a limb.
I don't think so. Yeah, I think it was, to me, I've been very curious about that, and I think you answered it in a very satisfactory, reasonable way. So
yeah, and
thank
I
you for
think,
that.
Amy, this is your wheelhouse. This is you're an OBGYN.
Yeah.
You're the only one that should be speaking this much about it. No, don't say that yourself.
Thank you. Thank you. This is a mutual love fest in here.
And again, just to bring back what you and Zara said earlier, is that we're not talking about it enough. And there are so many people out there that don't have the access, and maybe they can listen to the show and hear all the things you just said and say, this expert person said this on their show, and so I'm going to bring this to you and demand that you give me the care I'm looking for.
Yeah.
So I think it's just only helpful.
Great. I want to remind the audience, listen, if you have thoughts about endometriosis, you have questions, you have concerns, it sounds like if you want to speak to Zara, Please send us comments at radiofreerhinecliff.org or call us at 845-307-7446. Zara, is there a way in which people can tap into this Facebook page?
Yeah, I haven't been on it in years, I have to say.
Okay.
But I think if they Google Catamenial pneumothorax on Facebook, that they should see the group come up.
Okay. Is there anything either of you want to end with? Say,
I want to share a quote that I found that I thought was very powerful from Michelle Obama. And we mentioned that women of color do not get as much care and are marginalized. And so I think this is the perfect quote to share about women's health. That communities and countries and ultimately the world are only as strong as the health of their women. So true. I'm sorry, but we're the stronger. No offense, guys.
And I'd also like to add, don't take your health for granted, because when you don't have it, there's nothing more debilitating. Not all no money, no this, no that in the world can make you feel good if you can't find the right care. And listen to your body.
Absolutely.
And do something about it.
Thank
you guys. This was so much fun.
Yay.
Really, it was wonderful to have you.
Yeah,
and
thank you for coming.
For your clarity and your openness about this experience. Yeah.
Thank you.
I also want to thank Jen Hammoud and Matty Rosenberg, our producers, and to the Epicurean here in Rhiniecliff, New York. Please come visit. They have just yummy stuff, and it helps support local farmers and local folks. Again, please let us know your thoughts, and if you would, please give us 5 stars on Apple Podcasts. Make some comments, like us on Spotify. It just helps Allison and I continue this show and spread the word about all these things.
And send us feedback on topics that you would like us to address. Please.
Right. Yes, please. Yes, please. Be well. Stay well. Zara, may you have many years of wonder with your twins
Thank
and
you.
health to all of us.
Thank you.